Hi friends, let's have a look at this short case scenario where there is a 50-year-old female who was having pain in the right hypochondrium for the last 48 hours. Along with the pain, she was also having fever, and she was having Murphy's sign was found to be positive in this patient when she was examined 2 days back. Now suddenly she complains that she has pain all over the abdomen, and when you examine the patient, what you find is she is having tenderness, guarding, rigidity all over the abdomen. So what is the most likely clinical diagnosis and how you're going to manage this patient? So friends, as per this history, she was having pain for the last 48 hours. Along with Murphy's sign, which was positive, she was also having fever. So this all goes in the favor of diagnosis of acute cholecystitis. So she was having acute cholecystitis. But why this pain all over the abdomen, tenderness all over the abdomen, guarding all over the abdomen? This condition of guarding, pain, tenderness all over the abdomen goes in the favor of peritonitis. Peritonitis is basically a clinical diagnosis which we can form just by clinical examination in the form of tenderness, guarding, rigidity all over the abdomen. But what is the cause of peritonitis in this patient? This patient we are dealing with is having a dangerous complication of cholecystitis, and that is the gallbladder wall either becomes gangrenous or gallbladder distends and ruptures, and this gives rise to bile spilling into the peritoneal cavity, and this condition is known as biliary perforation peritonitis. And this is a dangerous condition with a high mortality. So how we are going to manage such patient? Such patients needs to be, first, these patients are usually dehydrated. So these patients need to be taken care of her vitals, like by IV fluid, IV antibiotics, and this patient needs to be taken care of by doing an urgent laparotomy. And the aim of the laparotomy is removal of the bile from the peritoneal cavity. That is, proper peritoneal lavage should be done with normal saline, and 2 to 3 drains are placed in the abdominal cavity. And the patients are usually discharged with the drain in situ. Drain in situ means the drain is placed in the abdominal wall and the patient goes home with the drain. And the aim of this drain is that the bile which is leaking from the gallbladder should come out of the peritoneal cavity with the help of this drain. Once the drain stops draining this bile, the drain can be removed, and the patient is taken care of the gallbladder by doing an interval cholecystectomy, which is usually done after a period of around 8 weeks when the patient recovers from the episode of this peritonitis, and when the adhesions subside, it is safe to do a cholecystectomy after around 8 weeks of the surgery. So this is all in short about biliary perforation peritonitis management. Thank you.